Hi guys, this is the Loud Voice podcast, and I'm your host Atieno Wasau. So, as you all know, the Loud Voice podcast season 2 is all about climate change, climate action, and climate justice. Just us trying to find ways to solve the climate crisis that we are in right now. Temperatures are rising, floods are here with us. We need to seek healthcare and all that. And if we can find solution to little solutions from us as people who are being affected with this, then the better for all of us. So this is what the Loud Voice podcast is all about for this season. And today, I have a question for all of us. This is something I believe that we all have had to experience at one point or another. Heck, so many times. Okay? So the question is, how many of us have had to go seek healthcare? And most of the time, they're not even close to us. Okay, you've had to move from one area to another to go to the hospital or any, and we have all had to use either a motorcycle, a vehicle, public transport. Some even have had to like travel abroad to seek healthcare. Okay, many of us we've had stories of people moving from Kenya or Africa to India, or moving from Africa to Europe or even the United States just to seek for healthcare. Okay. But do you know how much of carbon you're actually emitting while you move from one place to another seeking for healthcare? Healthcare is something that is a basic need. We all need it. And I'm not going to sit here and tell you not to go for that medical checkup or not to go see your doctor or gyna. Okay. But we are being told there are ways that we can actually cut on the carbon emissions because all those modes of transport you're using are emitting carbon, and carbon is harmful to our earth. All right. So, with me today is a guest that has an expertise on carbon emissions and how to help reduce it in the healthcare sector. I didn't even know that is possible. So, with me today is one Joel, and I want to call him Lion. Welcome to the Loud Voice podcast. I gave you a little introduction, but this is an area I have to be true to myself. I have no experience or expertise in, and that is why you're here. So most of these things, we are all new to this space, right? We've all been living here, and none of us actually knew this is going to catch up with us at some point. But we're here now. Yet there are people who, in one way or another, have experienced these things and decided, oh, let me do a little research on it. The rest of us, we can't talk about it. Okay, so welcome to the Loud Voice podcast.
Thank you.
Number one, I'd like you to just before we start, you give us an introduction of who you are, what you do, before we can actually like take it through. Yeah. So
Thank you so much, Rosal. It's been an honor to be here with you for the podcast today. You're doing amazing stuff. I'm happy. So, my name is Joel Alex Solang. I'm a Kenyan. I'm the founder of Urban Tech for Hope, which is a telemedicine startup that is offering healthcare services to individuals who have need. And we do that using our digital platforms. I'll explain that in need more in depth later. We have our prototype right now in Ethiopia. We're expanding with partners in Rwanda, Kigali, and we headquartered in Kisumu, Kenya, and that's me. Yeah.
um, you've talked about telemedicine. Okay, tele is more. You'll go into it, but before we go into telemedicine, uh, I'd just like to know from your perspective, how does climate change actually, like the healthcare system, actually affect climate change? How does it come in? Because we know every day these are people who are actually helping us when we are like facing the effects of climate change. You get sick, you go to these people, but we're also realizing there's a way these people are also like contributing to climate change in one way or another. So, how does the healthcare system or the healthcare sector actually affect climate change? Climate change.
It's interesting. I'm sure at the end of this podcast, you'll be like, whoa, I didn't know. Um, so it's a magical question. So the beauty of this is when we started our startup, uh, we were driven with a goal to provide healthcare, holistic healthcare services to people who had the need. And we pivoted to realize what we were doing had a double effect. There was a ripple effect that we didn't know we were having through our innovation. and that was around climate, right? Uh, put it weather. So telemedicine is interesting, right? So as you have the innovation going around and helping those in need, making things efficient, um, you realize telemedicine, there's a bit of communication aspect of it. So telemedicine is the use of digital platforms, video calls, all that, to have a medical service provider. Locally, you can put it in the context of a doctor, provide consultation services to the person who has the health need, diagnose and even treat. So for our case, we're using digital platforms that involve mobile phones, right? And we have part of our innovation that works on handsets, iPads, and laptops, right? So the beauty of this is we are reducing the aspect of individuals traveling by road, by cars, going to these healthcare facilities. And the reduction automatically, you see, it brings an element of reduced cars on the road, reduced fossil fuel use, right? And so that's an automatic direct impact on reduced greenhouse gas emissions. So our goal has been of late, since we pivoted, in as much as we provide the healthcare services to the individuals who need it, uh, we're reducing carbon footprint, digital carbon footprint. So when a person gets to be attended to, have their needs met through the telemedicine approach, we're reducing the paperwork. So the records, the administrative process has an element of the paperwork reduced, and also get to have a bit of we understand hospitals and healthcare facilities have energy consumption machines that are heavy duty. So when the whole process is through a telemedicine or telemedical approach, we have all that reduced. You see the impact on the weather and the climate.
Okay,
Beautiful, right?
I'm getting to learn something.
Yeah.
You know, when I was like going through it, I was like, oh god, this looks dense.
Yeah, yeah.
But now you explaining that, I'm also trying to think about it as I go, because now it's like helping in so many ways. Because number one, now it reduces patient's movement or doctor patient movement from one place to another, but it also like reduces the fact that all these paperwork in an hospital and all that, and you needing to go to an hospital, meaning their energy is supposed to be working and everything, but now reducing it a little bit,
Yeah.
you not going there,
Yeah.
so it reduces all these things. And
Yeah,
it sounds,
yeah.
it sounds,
It's
yeah,
beautiful. It's beautiful. When we learned that, we were like, oh, okay,
Oh, yeah.
let's go.
Okay. I'm here. I'm ready to learn, and I'm ready to like. I'm a person that likes hearing a new thing and realizing that, oh, kumbe, I didn't know this, and now I'm learning about a new thing. So when I asked about the impacts of climate change from the healthcare sector,
Yeah.
can you just like put them so that people know
Yeah.
these are the problem we're causing, the healthcare system is causing on the environment,
Yeah.
and then we'll talk about this is how telemedicine is now helping solve
Yeah.
it. So yeah, can you?
Yeah,
please-
that's amazing. Understanding that I'm African, as I say this, coming from the global south, sub-Saharan Africa, we have challenges in the healthcare sector where we have most of our folks fall sick all the time because we can't be able to access some of the products or services, vaccines, name it, and also just the landscape and the weather, from malaria to name it, diet, food, you know so most of our people most of the times end up not being well, and they need treatment, they need their health needs met, and so they're always on the run, they're always on the go, trying to go get treatment, go get a product to get them treated, and that means they're always on the road, moving up and down. And like I mentioned lightly earlier, we have cars moving around, we have whatever mode of transport they use. Mostly, we can't talk much of EVs right now. So you have vehicles that use petrol or fossil fuel, and that means greenhouse gas emission, which also, as they get to go for more of these services, gets also to skyrocket. So we are emitting so much greenhouse gas emissions as our people. And also, we understand that our healthcare services serving a lot of our people, the machines that work in hospital, we understand they're heavy duty, so the energy consumption is high. We understand we have blackout problems in Africa, so when there is a blackout problem, what's our next option? There are possibilities, and there are some facilities that are using energy options that are better, like solar and all that. But most of our facilities still go for generator, engine generators, fossil fuel again. And so you see the ripple effect gets to have climate affected in so many ways. The paperwork, the bureaucracy process when you go to a hospital, you understand our way. Yeah, you have to be in the line, paperwork. Yeah, for you to see a doctor. Yeah, you end up with like 3 or 4, pieces of paper, and all that paperwork goes back to to trays being taken down to have these papers come through, the chemicals and all that. So we get to have the weather, rather the climate impacted through the greenhouse gas emissions, not in a good way, in a negative way, and the paperwork and the energy use, heavy duty consumptions by the machines in the healthcare facilities get to impact the climate indirectly or directly.
What I also know, one with the healthcare system, especially in Kenya, in Africa, is they don't even have proper disposal channels for everything used in the hospital, like those bio. No, I'm not in that sector. No. There's how can I say it? There's different types of. What are they called? Come on, help me out. Like no, the syringes.
Oh,
Yeah, like there's a whole load of takataka waste coming from the hospital,
yeah.
and then you find that some of these things are actually going to be poured
not
on a
disposed rightly.
on a land somewhere
Oh, yeah.
that is meant for them. Okay,
uh-huh.
but remember, people also stay around these areas.
Yeah, and they
Like
get
you get
affected.
I don't know how they call them. I know there's always, even for like for waste outside,
Yeah.
the recyclable waste, the paper waste, and then kuna kuwaga na hizo zingine zenye that can affect us actually when you get into
And there's a way
contact
of
with
how they
them.
should be disposed of.
Exactly.
And some
So
facilities are careless.
some actually just like throw them on a line, and then it's covered. Then it comes back affecting people
when it
years
rains
later.
and all that.
Exactly. So I hope this is also like a way of helping to reduce that.
Pretty much. We've been creating awareness. We have partners, we have stakeholders, we have platforms that we get to have a forum with a bit of our stakeholders and like-minded individuals in the field, providers in the field, and we make them understand that telemedicine has a significant impact on the healthcare provision now and even in the future. It's not going to cover all the aspects of healthcare provision, right? But them embracing elements of telemedicine in their service provision, being conscious about the climate and the waste that comes from the hospital, waste after the treatment, all the how they should adhere to the right ways to dispose of their waste, and also being conscious on how the paperwork in the hospitals is trying to embrace more of the digital ways. Goes a long way in having a positive effect on the climate by reducing greenhouse gas emissions and just basically reducing the digital carbon footprint. Yeah.
So before we go into it, this is not something that so many people know about, or so many people have been in tune with.
Yeah.
I know there are hospitals already providing that, and I'm happy that you've been partnering with some of them.
Yeah.
But let me just ask before we go like into depth of it.
Oh, yeah.
How did this thought come by? How did you guys just sit somewhere and decided, oh, you know what?
Yeah.
You guys don't need to actually go to the hospital physically. You can actually meet your doctors online through video conferencing and things like that. So how did this come up?
Thank you. I like the question, and that makes me touch on the innovation. When I began the startup, it was so dear to me, and I used to at times refer to it as my baby, and so I gave it my all. So it's a bit the origin of the story is a bit personal. Back about a decade ago, half a decade ago to be precise, 7 years ago, I worked in workstations that provided healthcare services to individuals, and I was more like a field guy, taking people to the hospital, connecting them, getting them the consultations and all that. And I had a neighbor who was a mom, and was pregnant, and the process of going to see a gynecologist, moving up and down to the hospitals. I didn't live in a big city, so you go, you miss the consultant, you miss the gynecologist, you have to try another health facility, you move up and down. It was so much hassle. Sometimes you'll miss the services, and I was like, something needed to be done. That felt just so awful, in the 20th century where we are right now. And I did a bit of IT in my undergraduate, and I was working in the space where the provision was happening, and realized something could be done. So me and a couple of my workmates sat down, and that's how the telemedicine whole innovation was born. And telemedicine grew in provision of services, and Abu Sored, that the big empowerment came as somebody noticed it. I probably was going to mention this later, but somebody noticed it. Serious institution noticed it across Kenya and in the global space. So the work that we do through telemedicine was noticed by programs that also applied and was part of, as courtesy of the U.S. Embassy and the U.S. Department of State programs. I ended up with exchange programs, so I got exposure on how it works in the first world, uh, and how they're able to, reduce the effects of greenhouse gas emissions through telemedicine and just being energy conscious and all that. And I was like, this can happen home too. So that's why I'm back here to just, make this happen. Yeah.
I'm happy about like the background of it and how personal it is, because so many things are born out of a need.
Yeah.
You've seen something happen and then you're like, what if we could have done it this way?
Yeah.
Okay, and I'm happy that you came up with
Yeah.
them. We're not going to take away the fact that it's something that is already happening in the first world nations,
Yeah.
right? But it's something that was not here.
Yeah.
So I'd like to ask, on that note, I'd like to ask the adoptability of it. Like, how fast are people adopting it? People still like, no, that is still something. Because we also have to put this like into play. Most of households in Africa, in Kenya, are still not needed with like phones, internet connectivity, and things like that. For example, you want to meet your doctor through Zoom, and you don't even have exactly. Internet is a problem. Getting it, Wi-Fi is a problem. The connection already is another big issue, and just hospitals also. As much as households also lack, hospitals also have their own lack. So how is the adaptability of it so far?
That's a good question. I like it. Um, there's the challenge that Africa or the global South faces challenges when it comes to connectivity, internet connectivity, especially in the rural areas, the countryside, places that are not in the urban areas or metropolitan. But coming from Kenya, we understand uh, how we've been able to embrace the digital landscape, innovations, M-Pesa, and just as Kenyans, and uh, being on that space, we've taken a big portion of the cake, and we are really ahead. And also, there's data by serious uh, institutions that show young people, and by young people, I look at the age cohort of 35 to all the way to below 18. That we spend 70% of our time on mobile phones. And a good portion of that is counted to be Android phones or smartphones. And so with that, we realize that huge portion of our individuals, our people, Africans, being having access to mobile phones and being on social media platforms 70% portion of their day, we can be able to tap on that opportunity and harness them, let them be aware that they can be able to have the telemedicine approach working. And we also have a bit of something I was going to mention. It's called a USSD approach, which works on phones that are not really smartphone, where you go ahead and dial star 123 hash and stuff, and you're able to still get the same telemedicine services, able to talk to a doctor, consult, be diagnosed, be treated remotely. And so this helps, because you have problems with the infrastructure, location issues, and also we don't have much of our health service providers. The ratio is a bit low still, and we're hoping this is going to grow. Yeah, as the connectivity gets better, we have policies that are going to change the space. Yeah.
Okay, I'd also like to ask, apart from the adaptability, the viability of it now. Okay, and when I'm talking about that is the considerations before it's actually like we decide this is now the way to go.
Yeah.
Okay, I know most countries, and with that, I also like to ask you, like, if you've also thought about these things, about using this kind of technology, maybe in counties such as the counties in northern Kenya,
Yeah.
because right now they are experiencing adverse effects of climate change,
Yeah.
and they need to move very long distances, and sometimes maybe the doctor that knew about your health is somewhere in Wajir, and now you're moving from Wajir coming to Mandera, somewhere that is a little bit better, or in terms of maybe food security and things like that, or even in terms of security in itself.
Yeah.
So have you thought about taking it to places like that? Because I know there is a lot of challenge,
Yes.
but I think they would need it more. And then when I talk about viability of it, I meant, is it gonna work?
Yeah.
In terms of when I go to the hospital physically, my blood is taken. It's they go and check what is wrong with me. They come back with like real deductions on really what is going on with me. But now this is something that is going to be taking place online.
Yeah.
The samples and all that, because let's not lie.
Yeah.
I had a guy here the last time who was talking about getting to know people's health through waste and all that, and he brought in a very valid point about someone can lie about their symptoms or even exaggerate it, okay? Because in one way or another, we've had headaches and are like, I think I have malaria.
I know.
Okay,
Yeah.
so that is what I mean. How viable it is it? And then the considerations to be put. And then what do you think also about like counties that are experiencing adverse effects of climate change and security issues?
Yes. Thank you. That's a good question too. We're in a space of healthcare provision, healthcare. We're in a space of climate change, and not now, not a while back, not in the time to come. We'll have individuals who are going to be a bit skeptical. I say that in a harsh tone. We're going to be skeptical. They'll be like, "Is this going to really work?" It's worked before elsewhere for a very long period of time, and we're going towards a period where technology is evolving, a period where people are embracing ways that are efficient and effective. You've seen how Airbnb came through, and right now it's a big thing. You've seen how taxi works now, Taxify, Bolt, Uber, and there are the other firms. I know that I'm supporting any. Yeah, so telemedicine is going to be a big thing. Really significant, more so with the fiber provision of internet and internet services being provided more day by day by communication firms, the private sector. And so there's a lot of potential when the government gets to partner with the private sector and the NGO sector. When those three pillars get to merge or come together and decide to make this happen, it's going to work. What are you going to do about those who are in the north parts of the country, Kenya, and in areas where they can't be able to, get doctors, arid areas and all that? You remember I said the USSD approach, where you don't really need a smartphone to have the telemedicine services. So the USSD approach, just the same way you can be able to do transactions using different transaction methods, M-Pesa, name it, from other companies. So you just go ahead and dial, punch in the, the coordinates and like star, blah, 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 and you'll be able to communicate with the doctor and be diagnosed, and in some cases get treatment. Now, there are scenarios that data or information from this individual might not be legitimate or true in some context. And those are just challenges, not only in the healthcare aspect, not only in the digital or telemedicine space that we're in, not in the climate aspect. And it's about honesty. And these are people as a generation, hopefully in future, or there'll come a time that individuals will get to be more honest with themselves, provide the right data and have themselves helped, because they're not doing it for the doctor. You need to be treated. So when you don't say the right symptoms, you get wrong treatment, and who gets to be in more problems. So that's what you do, and I believe that's how it's gonna be.
So it's kind of a holistic kind of approach for all of us. Like we all take it personally.
Yes.
You don't give proper information about what you're experiencing in terms of your health, you get a wrong diagnosis. So it's going to like he's saying, it's going to need all of us coming and deciding, I'm going to tell it as it is, so that we actually seek help. Because I know there's so many people who are in areas where they can't really access a healthcare facility, or even the available healthcare facility has no enough doesn't have enough doctors or even nurses, and some even don't even have enough drugs or medicine and things like that. So I love that you have hope that it's going to work. I know there have been a lot of areas that have had challenges and all that. And talking about Airbnbs, people are skeptical about it at first. People are like, what? What do you mean? A whole house, especially landlords. My house, give it to people. Exactly. But now it's a huge thing. And same with taxes, like you said.
It's even offering employment.
Yeah, and right now there are taxes even for women only. Every day there is new innovations and all that, and I'm hoping this is also going to like go through that process and end up working for all of us at the end of the day. I'm so happy that you got to come up with that kind of idea. It's noble. So it's yeah. I'd like to work with you and see where we reach at the end of it. And I love the fact that it was like its initial stages are rooted in Kisumu. Okay. Do you have like a team that you work with for all this, or you do it alone?
And that's a good question. I really embrace synergy. I've grown up in my career or profession understanding that with teamwork, you got to get to move more ahead. And so, with that question, yeah, I have a team. I've had a team since inception, since the whole thing was an idea phase to right now is scaling up. I embraced a lot of individuals in getting things done. So we have doctors, or lightly mentioned individuals who are holding PhD level knowledge and handling the machine learning aspect of, because you have artificial intelligence chatbot in our platforms. We have individuals who I have IT skills from my information technology bit. We have medics, doctors, individuals who are pursuing public health or are pursuing public health skills, and individuals with business skills, hold MBA levels, and more than 50% of our team is women. Yeah.
I'm all for women inclusion, women empowerment. I know people will want to call me a radical I'm a feminist. I like everything. Like women get what is good for them.
I know, right?
Okay, I think we can be best friends.
I know, right?
Okay,
So-
that is nice. I had a
Yeah.
question about the last, I think. Uh like an estimation, or maybe if you have your own data, because we need to also get like the statistics and numbers to it, because we are helping at the end of it. We want this to help reduce the carbon emissions, and in the end of it help us conserve our environment, our earth, and all that.
For generations to come.
Exactly.
Yeah.
I want to get like an idea of numbers. How like about what percentage is it helping reduce when it comes to like carbon emissions?
Yeah. So the greenhouse, the climate fund, the climate space, reducing greenhouse gas emissions, digital carbon footprint, is a new space right now. I'll say in the global south, where individuals are like, you can get carbon credits. You can use that for kind of gains, and you can be able to quantify how much you as a company, you as an individual, when you use less fossil fuel machines, you get to have an effect, and it's quantifiable. It's a new space. Um, we're not in the business of really quantifying or going to the carbon credit space and all that. We just like how much can we, through our digital platforms, through telemedicine, be able to reduce greenhouse gas emissions, reduce the digital carbon footprint, and be able to have a tangible or substance save effect to the climate. And that's the space we are in right now. Probably in the near future, we'll go into the carbon credits, being able to quantify the amounts, the gains that come with it. But right now it's new, and we're just trying to empower individuals with the knowledge and be able to have this happen, and tangible effects. Yeah.
I like that it started out as a way of helping communities receive health care.
Yeah.
And then in the middle of it, you learn that, oh, so actually it's also helping conserve our environment and helping reduce carbon emissions. I'm happy about that. I'm happy that you people came up with this idea and now it's being used. Like I asked you, do you have like a certain maybe healthcare facilities and individuals to give us an idea of, people like hope, like, so
Oh
this
yeah.
thing is really going to work.
Yeah, it's working. Yeah.
Do you
Yeah.
have like specific data on maybe the number of healthcare facilities that have
We've
actually
served a number of
adopted?
we've served.
Exactly.
It's a good question. I wish it came earlier. So I'll begin from the back, going to the front in addressing the question. Right now, we have a target of being able to reach 1 million people in 2 years' time. And so we're basing that on the data that through our digital platforms, since we began the trend, and right now, on average, we're able to reach 350 individuals by the 5 programs we are handling. And that's from serving individuals with HIV/AIDS needs, individuals under care, gender-based violence survivors, pediatric services, mental health, and there's a legal aspect, which comes from the gender-based violence survivors, where some would want to seek justice or want to know what the Constitution says about the whole issue. And that also makes us stand out different because we're not just offering healthcare services needs to individuals. We are doing it in a holistic way. We are giving you just more than seeing a doctor. We're giving you psychosocial support, counseling before you go see the doctor and after you see the doctor. Need extra services of a lawyer or understand what the legal portion of it says. We're also able to get all that to you at a go. So yeah, so with the numbers, 350 per the 5 in a week, we're looking at being able to meet over 1 million within 18 to 24 months. So that will be on the healthcare bit, and on the climate bit, also numbers that are coming. Yeah.
Oh, I like that. So my last question was, do you think this is the future of the healthcare sector? And I'd love you to tie this with like your parting shots, and then we just like close it. So, Ninias, convince us that this is.
Oh yeah. Thank you. I like the question. So Airbnb was here as it came. People were a bit not so receptive. Um, Taxi, Uber, Bolt was here. You saw the reception. Transactions, digital transactions through our phone. When they started, people were like, a bit skeptical. And right now, they're game changers. They're offering employment, and people are using those services so much so. So I'll call on like-minded individuals, partners, stakeholders who identify with what we are offering, the services, the telemedicine bit, who are on the go, climate justice individuals and advocates who are standing in the space and they are like, let's do this for our people. Let's avail the healthcare services in efficient and best way possible. Conscious of our current generation and generations to come while we do this. And we'll be able to go a long way. And this is the future. It has a lot of significance, telemedicine, in terms of how healthcare is going to be provided in the time to come. And we are not going to change the whole game, but we're going to change a big portion of it. So I call on you, let's get to do this. Let's save our people and make the generations to come and right now have a better space to live in. Thank you.
That is an amazing project that
Yeah.
you and your team are like taking part in. I'm happy about this kind of innovation, and that I'm like, I can't wait to see where it goes to and how
Yeah.
big it's going to be, just
Yeah.
like the ones you've mentioned.
Yeah.
And I'm happy that I am here as it's starting here in Kenya,
Yeah,
here in
yeah,
Africa,
yeah.
and things like that. And I'm happy that you people are going into like markets outside Kenya, Ethiopia. Like you've mentioned, is it Rwanda?
Yeah.
And that is amazing. I wish you and your team all the best.
Thank you.
Okay. So guys, that is all I had to for you, me and Joel. Like you understand, we use so much resources moving from one area to another. Like I like I started, some even move from Kenya to go to India to look for medicine. What if there was an easier way of you actually still being here in Kenya, but still being able to talk to that doctor or that medical expert in India? okay, while you're here, because I know there's so much resources used for traveling, especially the international traveling and all that, and so many Kenyans are going that direction, especially when it comes to chronic diseases. And if there's a way we can actually help on reducing that, like bringing it just a little bit down for our people, because life is so hard right now. We can't really to bring that out. Life is so hard right now, and just seeking healthcare outside the country or even in the country is so expensive. So imagine someone going out, it's triple of that. Okay, so guys, that is all we had, and I hope you got to learn something as much as I did, because this is something that wasn't even in my mind, and now I'm blown away. I like learning new things every day, and this was one of them. So I hope that this initiative is going to be a very big initiative where we are all going to adopt it and move with it and see where it's going to take us. And other than that, I think that is the end of us, like here. And from us this side to you on that side, we just like to say bye bye.